tried to go live when I was leaving my appointment for today. Let's see, it's Thursday, and good afternoon to a lot of you at this point, or evening, um, but definitely past morning at this point here. And yeah, went to the dentist and was hoping to uh, knock two birds with one stone because had to get the regular cleaning and stuff, but then also get my cap replaced and with the permanent. And um, but an emergency came up for another patient, so the dentist got kicked way behind, having to help the other patient. So, but that goes to tell you that there's always somebody else going through something harder, more difficult. So, you know, we we help. That's why we have a channel like this, to help support each other with situations, with going through the daily challenges. So I will have to still go back next week for the cap. But also, when I tried to film out there, it was too noisy, too loud, so it didn't come out clear. So that's why I'm trying to give you a little recap here, which, as you can see, I'm back home in the comfy couch at the moment. Um, you know, little things like that can just wear you out sometimes. Getting to your appointments and back, and depending on the day, like I was having one of those days where I didn't know if I was even going to make it to the appointment because of all the neuropathy pain and stuff. So, but I did, and um, now that I'm back, though, I actually put my TENS unit on. Well, this one is for, actually, if you can see it, the feet. They're like sandals. It's hard to see. Chancletas, as as we call them. But that's supposed to help give the send the current through my feet, and it goes up the leg a little bit, which helps in the calf muscles and stuff. So trying that's a more recent TENS unit type device that we got. Um, let's see, the True Stem. And hey, if this works, uh, definitely going to be a testimony to that. And yeah, hey, maybe get them as a sponsor, because if it works for me, oh my goodness, I can only imagine. In fact, when we got it, um, he was kind of telling us other patients it kind of works for, and I had that feeling that he was kind of curious to hear what my testimony ends up being, since I have a very complex medical situation case. But he did say there was some like diabetics that he would see that the circulation was so bad where your feet, your toes and stuff get blue, where it's that close when, God forbid, people have to get their legs amputated and stuff. But he said, yeah, he saw people that would come in there with the low blood circulation, and just by using their units, their type of TENS unit, that it did actually clear up the legs, started looking better, not all blue, and help the circulation. And so thank God I'm not to that point. And when I saw the podiatrist like a couple weeks ago, was good. But it's just the neuropathy pain, the stabbing pain that I'm trying to alleviate and get rid of. Besides another miracle by God, which He's done before, and we'll always keep believing He will do again. So, I basically said I'm gonna keep your daily dosage your diary that way of what the days consist of. Um, it's it does become a full time job, even being a patient, if you want to call that. You have to have a lot of patience to be a patient. Hey, Lisa Boo. So yes, very interested to see how it works, and again, will be a testimony and be like, okay, yeah, if you guys are dealing with this type of pain, or use it. It works. It helps because everybody hates that pain, anything that you're going through. And a lot of times when you can't see it in the person either, they might be dealing with pain, but they don't express it on their face, or they just fight through it. So I sympathize, empathize for a lot of people out there, and try to not judge other people. In fact, I was talking with the the tech that was doing the cleaning. Boy, she had testimony herself, and she's a breast cancer survivor, and she even said that it's still they still found it like wanting to attack her lungs, but I guess it's in a way where they can continue to just treat it, and then instead of having to go through like more radiation or removal, or just a steady type of chemo med. And but just again, you would have never known. She's there working on my teeth, but we're just talking, and she's a survivor also. So yeah, just more power to you. Like, God always has us here for a reason, and living testimonies, literally living testimonies, and continually growing. So it was nice to be able to talk to her, and in some ways relate, and in other ways just like encourage each other also. Um, I got to talking a little bit about the thyroid medication that was recalled, and because she was sharing on hair loss and how it was traumatic because of how people stereotype and look at you, and have this stare for with no consideration. They just automatically almost judge. And the difference of like when you shave your head, or when it's just a dramatic change because of chemo medications. And I was experiencing that with the thyroid medication because of its recall and it jumping my levels all the way up. So yeah, if I could really show you, I'm very tempted to chop the hair off. We might just shave it down, because there are, if I really wanted to show you, some balding spots going on, all because of transitions of medication. Hey Shelly, good to see you. But so yeah, like part of me wants to go into the detail of showing you, but I'm like, okay, no, still trying to cover some of that up. So who knows? You might see this cut off, shaved off. Uh, I'd like to know your opinions, your thoughts on what I should do with my hair, since it's thinning out so much until the medication gets regulated again. And then who knows? I'm praying it grows back even thicker. So there's a pro to this. I believe there's going to be a pro to this falling out. Like that's why I actually have this cover on the couch, the sheet, because so it could be the lint brush daily. You could just throw it in the wash until this phase is over. But no, that's basically what the ups and downs, the roller coaster of living with lupus and other autoimmune conditions, and just beating it all and just building the testimony. So, um, the rest of the day, actually, the TENS unit stopped, so it went through its treatment is the little device that controls it. So that may be my cue to maybe get a nap in, rejuvenate, recollect the spoons for the rest of the day. Because right now, lunchtime, you can't be calling doctors' offices and stuff. They're at lunch break. But that'll probably be what comes up in the next half of the day. So, yes, we are both overcomers, Lisa. I know you. You feel it. You're a strong warrior too. So, thank you guys. Yes, okay, Shelly, you have a TENS unit. So it does help you. See, when I had a TENS unit years back, it didn't help. Like, it just, I don't know if it just wasn't strong enough or what. It just didn't resolve that. Now, I used it a lot for the AVMs in the leg, the arteriovascular malformation, like strawberry patches inside my calf, and which is rare, unusual. They're more in their upper extremities and not lower. And so there wasn't really procedures that they could do on it. And I claim that's a miracle that the pain finally alleviated after 12 years. But when I used the TENS unit on it, it never helped. Pressure, socks and boots and stuff didn't help. TENS units didn't help. But I think they have advanced, Shelly, and stuff in the TENS units where they can really reach the nerves and try to, I'm anticipating it to reprogram it a lot so it can take that pain, those other chronic pains, completely away too. And right now I'm just using the foot ones, but they have different ones, gloves and different patches for different parts of the body. So I haven't really experimented too much with everything yet. So that may be a future stream, seeing the other areas that it can be used on. So yeah, you agree it's the current stronger. They've improved that. And what they wanted to do was put the permanent one in me, like surgically apply it. And that's, you could say, still a little bit in controversy because of the other medical issues and the risk, because it's been qualified for people with diabetes, where before it was used for other reasons. So it's been around for years, but it's just more recently that they qualified it for people with neuropathy from diabetes. And so I was going to one doctor for that, and yeah, they didn't like the rest of the medical history. They were too concerned about the blood clot history and the level that my A1C was at, which it did come all the way down to 7.2, which that is really good. Like, all my doctors are impressed. And then my endocrinologist wants to refer me to another doctor that might be willing to do the procedure to implant the TENS unit. But I want to see how this exterior, remote one goes before having to do another surgical procedure. So, but I see that, yeah, you guys have some experience with the TENS units, and Lisa, yeah, try it out. Like, as far as the external ones, they seem to be getting better, definitely. And we'll give it, like, I just started this week. Of course, just like anything else, just like if you have surgery, okay, 6 to 8 weeks at least, if not 3 months for recovery, for healing. So we're going to give it that much time to see how much the TENS unit changes the neuropathy. So, yeah, because I was so hesitant, Lisa. Like, the other one, oh no, it didn't do anything. And because there was a few doctors before that was like, well, you can try a TENS unit. I'm like, yeah, right, whatever. That doesn't do anything. Finally trying it, and I am feeling some difference just within the first few days of using it. So anticipating a good report from that. Just like some of my labs came back good. So that's 7.2, and we're going to keep getting it down. So, but enjoyed this conversation with you guys and hope that it grows and continues, and we get the word out there. We get awareness and support for each other. So, yeah. So get some good work in there. Thanks for popping in, Shelly. And love you guys. And I will try to keep this up daily. See you next time. Like, subscribe, and share. Get the word out. Bye, guys.